Hi, I'm Dr. Tim Gelsema. I'm one of the sports medicine fellows here at Henry Ford, and this is Dr. Anthony Tam, also one of the sports medicine fellows here. Today we're going to be kind of going through a shoulder exam. It won't be comprehensive, but it'll be things that every family medicine provider should be able to perform in the family medicine clinic. The first two things with the shoulder exam that we'll start out with are observation and palpation. So when the patient's seated on the table, what you want to look for is symmetry between the two shoulders. You're looking at the muscle bulk on each side. You're looking for any deformities coming across from the AC joint to the SC joint. Now in the clinic, what you will do is you will actually be palpating from the front in this manner, but so that you can see what I'm doing, I'm only going to be palpating on one side. So what I will do is I will start and I will work my way from the middle to the outside, or medial to lateral, starting at the SC joint for any step-offs, any bulges, any tenderness, and I work my way along that clavicle until I get to the AC joint, okay? Once I'm at the AC joint, what I will do is I will work along the acromion to the posterior aspect of the acromion, and then what we will do is we'll show you the posterior aspect from behind. So what I will do is I will start by palpating along the scapular spine until I hit the medial border. Once I've hit the medial border, I work my way down all the way. Okay. Once I've palpated the bony landmarks, I will go into the supraspinatus fossa, palpating along the supraspinatus, and then I will feel again that spine and go just below that into the infraspinatus fossa. After that, what you can do is you can palpate the trapezius muscles, feel for tension, feel for symmetry, and then the rhomboid muscles along the medial border. What I like to do next is check for pulses, check sensation, and check deep tendon reflexes. So I kind of do a systematic approach with the sensation. I start with the axillary, which is going to be that textbook cape distribution. C5 along the front. C6 I check with the thumb. C7 middle finger, and C8 the little finger, the pinky. Okay. I check radial pulses. I will check both of these at the same time just to make sure that they are both equal. Next step is I will go into the reflexes. And there's three major reflexes that I want to check in this regard: the biceps, the brachioradialis, and the triceps. So to assess the biceps, have the patient supinate their arm all the way, and you can support them. As you can see, we had a nice reflex. For brachioradialis, have them pronate, go approximately halfway down the arm. As you can see, again, good reflexes. And we will go to the back so you can see the triceps. From the posterior aspect of the arm, what I'm going to do is I'm going to palpate for the olecranon, the tip of the olecranon, and I'm going to go right above that where the triceps insertion is. And if you were in the front, you'd be able to see the contraction. So you can see contraction back here. Next movement is forward flexion. Okay. I have them come down to the sides and then do abduction, up and over. Okay. And then you can also do abduction with external rotation or abduction with internal rotation. Okay. We will show you internal rotation from behind. For internal rotation, I have the patient usually start with their unaffected side or their uninjured side and reach up as high as they can with their thumb or their pointer finger. Okay. I tend to make a good mark with my offhand so I know where they're ending up, and then I have them reassess with the other arm. The next thing we'll be doing is assessing the strength of the shoulder muscles, the rotator cuff muscles, and the deltoid. And we'll start by doing them in full abduction to do the posterior fibers of the deltoid. Okay. Then we'll do forward flexion to test the anterior fibers of the deltoid. Okay. And then we bring them into about 30 to 40 degrees of external rotation. Put the thumb down to try to isolate the supraspinatus and check from there. This is called Job's test. Okay. Next, we will check the internal and external rotators of the shoulder, okay? So we have the patient have their arm tucked in at their side, and we will be doing resisted external rotation and resisted internal rotation. Again, do these tests at the same time on both sides so you can provide the patient with some stability as well as assess any difference in strength. Next, we'll be checking NIRS, which is a sign looking for impingement in the shoulder. We passively raise them up, and we're looking for any recreation of their symptoms. Another test that we can use to assess for impingement of the rotator cuff is called the Hawkins test. What we will do is bring a patient's arm up into 90 degrees of abduction. Okay. What you want to do is rotate their thumb in and provide some downward force as you push up on the outside with your elbow. Recreation of their symptoms is a positive sign. Next, we'll be checking for instability of the shoulder. One test that we use is O'Brien's test. Bring the patient into forward flexion, about 10 to 20 degrees of internal rotation. And again, I like to do thumbs down. What we're going to do is we're going to have them resist us by pushing up. And you want to see if they have a sense of instability in that shoulder. Next, we will rotate thumb up or palm up and recreate the same movement and see if that reproduces the pain as well. Okay, we'll be doing two tests now to assess instability of the shoulder. So in a patient who may come in with a history of dislocations or recent dislocation, what you're going to do first and foremost is the sulcus sign. So grab the patient right at the crease of their elbow, and you're going to provide gentle traction downward. And what you're looking for is any gapping, or what we call a sulcus, between the humeral head and the acromion. The next maneuver we are going to do is called the AP glide. Okay, with your offhand, stabilize the acromion. And with your dominant hand or hand that's easier access for you, grip firmly the humeral head. And what you're going to do is you're going to see if you can translate or glide the humeral head anterior posteriorly. And you really need the patient to be nice and relaxed for this to get a good assessment. The next exam maneuvers we are going to do are called the apprehension and relocation tests. For the apprehension test, it's important that you have the patient slide all the way to the very edge of the bed so that they're almost falling off. You want to have their arm in 90 degrees of abduction, and you want to have them in external rotation resting like this. With your offhand, support their elbow. Your main hand, I want you to provide gentle external rotation force. If the patient notes discomfort or feeling of instability in the shoulder, they'll typically verbalize this. And then what you will do is you will do the relocation test, where you will put your arm over the humeral head and see if that relieves the pain. If that does relieve the pain while you have them in the external rotation position, take your arm back off and see if the pain comes back.